So welcome to Defying Gravity, Angela, Dr. Angela Lim, in fact, founder of Clearhead. Tell us, what is Clearhead, and how did you come to found it?
Thanks, Helen, for having me. So my background is I trained as a medical doctor and was very passionate about, improving access to care. So got involved in health technology from basically medical school. And then went to Harvard to do some research on how to improve the problems and worked with government implementing these big technology solutions across New Zealand. And then went basically back into clinical medicine in the hospital and just wasn't seeing the type of, outcomes that I want, where I often see people coming into the hospital after things are much further along when you could intervene them much earlier. And so thought that with the high youth suicide rates that we have, there must be a solution that we could use, especially with a lot of the emerging technology like AI. So in 2018, decided to start Clearhead with my co-founder, who was an amazing software engineer called Michael. And we decided that we wanted to solve the problem around access to mental health support. And we did it in two ways. One was we used AI to make that care much more accessible 24/7 and less stigma. People can kind of reach out and say, I've got this problem, and get guided on some solutions, whether that's self-help tools or whether they should actually book therapy. And then if they did need to book therapy, we had a sort of network of more hundreds of therapists across the country in New Zealand and Australia that they could see very quickly within a couple of days rather than the sort of 6 months wait time that existed in the public system. And so as we sort of evolve, we really thought about who should the payer be so that we can not have cost be a barrier. And we decided to pivot into that workplace well-being EAP space and really having employers provide that support for individuals. And one of the things that we try and add as well as a value to these organizations is around the data reporting around psychosocial risk management. So about 40% of problems that people require therapy for is actually work related. And so the workplace has so much more opportunities to allow their employees to thrive if they understand what was going on,
Yeah.
how they designed the workplace in a way that is adding stress to the employee or helping them thrive. And so this data reporting that we also use AI to kind of analyze and provide recommendations on is a key part of that solution. And so we thought about Clearhead really being that holistic solution that improves things both at the employee level, getting that self-help, that therapy very quickly, and then supporting managers, leaders, and boards to really understand what's going on in the workplace and then tackling the root causes to make
Yeah.
workplace a place that people can thrive and be happy in. So yeah, that's kind of the mission that Clearhead is on, and a privilege to be able to share.
Yeah. Amazing, amazing journey. Congratulations. It's a beautiful preventative as your original kind of impetus was,
Yeah,
solution in
absolutely.
number of
Yeah, I think
ways.
we basically support more than 500 organizations now across New Zealand and Australia with at least 10% market share. So, it's knowing that we are slowly working our way to supporting every single New Zealander and Australian out there, and then and ultimately the world would be our mission.
Beautiful, beautiful. What an amazing, amazing story and amazing background to do it. Now, I'm sure some people get excited, investors certainly, and techies get excited on the concept of AI in healthcare. I think it can have a huge impact too. But I'm sure there's others that listen and think, oh, how scary, personal data, mental health, going out into large language models, etc. Talk to me about how you kind of handled that trickiness
Yeah.
of AI in the world of mental health.
Absolutely. It was really interesting because when we started in 2018, AI definitely wasn't as well accepted as it is today. And sort of our approach to doing this was to make sure that we always get the right people involved. So making sure that we had clinicians involved from day one with reviewing how we were planning to build the
Mm,
algorithm that was supposed to be mental health specific,
yes.
and ensuring that, we have all this clinical safeguards. So we started off the process very much with what are the risks associated with this technology?
Yes.
How do we, ensure that there is a mechanism to reduce or eliminate that risk? And if we can't completely eliminate that risk, what is the continuous improvement process around reviewing the data, reviewing the responses that AI provides,
Yeah.
to ensure that it's safe and it's clinically effective, and always defaulting to what best practice is. So whenever we, for example, flag someone was suicidal through the interactions with our AI system, we were able to then make sure that they were matched with a human therapist that can allow them to actually work through and de-escalate the situation and get them the right level of care that they need. So it's very much not just taking a overly optimistic approach that AI will solve everything, but
Yeah.
acknowledging that there are limitations, but that our current system also isn't working. People can't get help when they need it. So how do you augment the system and really try and get the best of both worlds?
Yeah, yeah. I much prefer augmented intelligence to artificial sometimes. It's more human. So,
Exactly.
awesome. Awesome. So tell me, Angela, what was the biggest challenge in building your business to the, I know, millions of gross revenue you now have? Um, what's been your biggest challenge?
Yeah, I think I've always been very ambitious, and I wanted to transform the mental health system. And I felt that we had absolutely the opportunity to do that, not just in New Zealand, but globally.
Yeah,
And I think one of the challenges initially was around, okay, where do we spend our limited amount of time and money and resources on? And one of the idea behind how we would solve that problem would be, let's go raise lots of money.
yeah,
And that's been a little bit of a challenge in terms of the ability to kind of time the market right when we went out and tell the story in a way that was compelling enough for the right investor to come on board.
yeah,
So in the end, we sort of continued on with our path and bootstrap our company to the way that it is today, and ensuring that we never sort of like compromise on quality, but continue to think about automating as much as possible to deliver scale with a limited resource. And so that's kind of probably one of the main challenge that we faced, was around we had this big ambition and maybe not quite the resourcing to achieve it very easily.
yeah,
And I think one of the things that's been really fascinating for me to learn is that it really also isn't always about money. We have since interacted with companies who might have raised even hundreds of millions of dollars. And I find that they have the same problem as us. They always still say that they don't have enough money, they don't have enough resources. And I realized that actually money is sometimes just a proxy to the underlying structure of how you set up the business, so that it can be scalable, so that it is still staying true to the mission. It's
yeah.
one of the reflections I've had over the last couple of years.
Yeah, that's really profound. Yes, it's focus and it's constant ambition leaves you feeling resource constrained even
Yes,
time, right?
exactly. Yes, but
Yeah,
focus is so key. And I
yeah,
think the other thing as a CEO you learn is you have to understand that your different team sees different parts of the problem. And
yes,
so when you're talking about focus, how do you get alignment at a company level, and that everyone's focused on the same thing but doing their own, separate items that would move the dial forward,
yes,
and also being able to really kind of prioritize, because each person will see the problems on their side and they'll tell you their problem is the most important problem and this is what we should be focusing on. And so often we have this tension between sort of scaling up and growing really fast versus making sure the system is stable enough that it doesn't break and we keep our customers happy as we expand. And I think that's one of the tensions that you often see with scale up companies.
Yeah, absolutely. Everywhere at every stage. And I mean, bootstrapping as you have is a hell of a way to keep that discipline, isn't it? And
Yes,
make sure everyone's
by
with you.
necessity.
There's
But
there's no spare capacity. It's an incredible job. Awesome. So just to finish, what is your top advice? 7 years of building something really wonderful. What's your advice for a startup founder or even a new CEO?
yeah, I mean, we are where we are today because of the team that I have and also the co-founder that I have. I'm so grateful for the diversity in the team that allows us to kind of have the expertise across to deal with all the different problems that arise that you have to solve all at the same time. And because everyone has their own different expertise, we could kind of move the pieces together in synergy.
Yeah,
And so I'm a big believer of hiring and hiring really well. Trust your gut. If you feel that someone's not right, don't force a hire. It's better to wait.
yeah,
And then if you do make the wrong hire, in a very humane and empathetic way, try and support them to kind of transition off because them staying can often create toxicity in the company that is unhelpful.
yeah. Awesome. It's so important. People, people, people.
100%.
Yeah, yeah. And yeah, I have a saying, I think it sounds of similar philosophy. If in doubt, don't hire. It's
Exactly.
there's no worse
Exactly.
decision. Awesome. Thank you so much for coming on Defying Gravity.
Thanks for having me, Helen.